Good morning or afternoon, everyone. My name is Sierra Johnson. I'm the Education Manager with the VPPPA National Office, and I'll be your moderator for today's presentation. I want to thank you for joining us for today's webinar, Workplace Violence Prevention, Fortifying Employer Efforts. Just a couple of quick housekeeping items before we get started. We will have time at the end of today's presentation for Q&A, so if you have any questions for our speakers, please feel free to leave those into the chat located on the right side of your screen. Today's presentation is sponsored by BSI. BSI enables people and organizations to perform better. They share knowledge, innovation, and best practices to make excellence a habit all over the world every day. For more than a century, BSI has been challenging mediocrity and complacency to help embed excellence into the way people and products work. That means showing businesses how to improve performance, reduce risk, and achieve sustainable growth. If you'd like to learn more about today's sponsor, I do encourage you to check the link down below today's presentation. Your speakers today will be Kerri Greene and David Blacksberg with BSI. Kerri brings 33 years experience as an EHS regulator and consultant. She's an enthusiastic trainer and EHS program team manager with an extensive background specifically with Cal OSHA compliance, aerosol and bloodborne disease management, emergency preparedness, workplace security, and violence prevention. And joining Kerri today is David Blacksberg. David brings over 25 years experience specializing in emergency management, business continuity, safety, security, and workplace violence prevention. David has been a leader in developing strategic partnerships and has developed strategies to meet regulatory and accreditation compliances, as well as developing, facilitating, and assessing trainings and exercises ranging in scale and scope from the single facility to the multi-agency. We are very excited to have you both with us today. And with that, the floor is yours.
Thank you, Sierra, and thank you everyone for joining us today. Again, my name is Kerri Greene. I'm a principal consultant with BSI Consulting. I am interested in workplace violence prevention starting at the very beginning of my career when it was as personal safety, doing inspections and enforcement in the field by myself. And then as I became a consultant, started sharing that experience, training with law enforcement, most importantly, listening to employees and how workplace violence incidents impacted their lives at work. That really got me passionate about the topic, and I very much appreciate the chance to share with you today the work we've done over the years, the tips, tricks, pitfalls, and some best practices on workplace violence prevention efforts. And I'll let David introduce himself further and kick us off.
Thank you, Kerri. So good morning, good afternoon, good evening, wherever you may be located. David Blacksberg, Senior Consultant with BSI. And my passion comes from when I was working EMS as in the fire department of New York City, where I experienced and witnessed a lot of workplace violence. Excuse me. And I continued my career in emergency management and business continuity in the healthcare field. In hospitals, you can really see and witness unfortunately, a lot of workplace violence, and it's something that I am very passionate about as well. So we are glad that you were able to join us, and we will be sharing a lot of information that you can take with you, and we look forward to further discussions at the end. So what is workplace violence? It's any act or threat. And that is something that we need to make sure that there's an emphasis on. It's not just the act of, but the threat of physical violence, harassment, intimidation, and it results in physical or psychological harm. It can affect employees, those around the employee that is immediately in the vicinity, and as well as others, as well as clients, customers, visitors, anybody that is around you. So the OSHA describes workplace violence with 4 different types. There's strangers with criminal intent, there's the customers or the clients, the coworkers, and then the personal relationships. Strangers with intent, you can take this as somebody who comes in and tries to steal a product or steal money, and they want to have they have no further relationship. You've not seen them before or witnessed them before. Customers, these are people that you may see, may know, they're clients. Coworkers, you know, you're working together, you're most of the time together more than you are with your families. So there might be some areas where there'll be some conflict. And then the personal relationships, you know, coming from the home, going into the workplace, all of a sudden you have some acts that might be coming into the workplace. So why do we prepare? We want to prepare and help you and make sure that you are working within your organizations to make a safer environment, both mentally and physically. Having a stable environment helps to make sure that everybody is happy and continues to work with your goal in mind of completing your product. Liability, there's litigation, there's enterprise, and of course, reputational. So if something does happen, the news will always be there, especially in this day and age of 24/7 news. There's always somebody taking a look and seeing what's taking place. So the reputational liability is always there. And then, of course, there's compliance, is state regulations and requirements. And then, as we'll be discussing today, California is the first state with general industry workplace violence requirements. So we want to make sure that you have what you need to make sure that there is a workplace violence prevention program and plan in place. Kerri.
All right, so let's talk about that regulatory landscape as a little bit more background before we get into the meat of the presentation. But as David mentioned, California is always at the top of that conversation list when the healthcare regulation went into place in the state. And now with the latest regulation for general industry, it's really cropping up that conversation for worldwide, nationwide, and obviously any of the employers that are in the state of California, those worldwide national organizations that have facilities in California, they all need to be prepared to comply with that California regulation. But in addition, looking at those other state regulations, you can kind of see there are other requirements out there. They're affecting different types of industries. So just to give you a lay of the land as we have it as of this year. Next. So here's California's summary of SB 553. Everyone's talking about SB 553. That basically has gone into effect. It was passed into law. It changed the California Civil Code. It changed Labor Code, and it will be in effect and enforceable July 1st of this year. This was a legislative action. Cal OSHA had a regulation for general industry on deck for years and had not advanced with that. So the legislature passed this. But interestingly enough, Cal OSHA will be enforcing these labor code, civil code changes starting July 1st. And then later on will pass their regulation. And there are great similarities to that Title VIII Code of Regulations that affected healthcare in 2017. Next. So here are some of those elements of compliance that are in the labor code changes, and it's basically having a written program beyond a policy. It's very prescriptive what they are expecting in the program for California, and understanding what they want to see in that will help you comply when you're writing your program. And we'll talk a little bit about some of the tips and tricks and best practices for that later. Because whether you are in California trying to comply with this regulation, or maybe you've identified that there are hazards related to workplace violence in your operations, in some of your job occupations, you may be wanting to look at what are these requirements that can make a best practice, a high-level EHS, HSE program that you would want to adopt, even beyond the California operations, or even beyond what may be required depending on your level of risk. So assigning responsibilities, having a program administrator, a list of people and resources that employees can go to that are responsible for implementing the program, having those hazard and risk evaluations. We'll talk about this because it's not just a general idea, but they want very specifics down to the job specific and the facility specific hazard and risk evaluations. And we'll talk about that. Listing what controls and corrective actions are in place and which ones can be implemented. So when you're doing this, take stock of what you already have in place so that you get credit for what you're already doing. And then as you do those hazard evaluations, additional items may come to light that you would want to implement. Having a reporting mechanism, so some way that's easy for employees or other employees from other employers to access and report an incident as it happens. Those emergency response procedures. The training is very prescriptive, and we'll talk about some solutions for that. And then, of course, records of all of those efforts to show how you have implemented all of these requirements. Here's a quick summary of the training frequencies. It really aligns with the Cal OSHA Injury and Illness Prevention Program requirements, I2P2 for California, on an initial training when the program's adopted. Employees are given the training at orientation before they face the hazard. And then if they have any changes in their assignment that may change their risk or hazard access, if you see changes due to new processes or unrecognized hazards, then retraining. So really building in that cycle as new information or changes happen where you're updating training and touching points on each of those changes. And then it's very prescriptive in what topics need to be in that training. Next slide. So here are some overviews of statistics, and I'll first start with the Bureau of Labor Statistics in 2022. This is their last certified data. And in that year, workplace violence was the number 3 cause of fatality at work. There were 849 fatalities related to workplace violence. Of those, about a third were suicides at work, and we'll talk a little bit about that piece later. And then according to OSHA and CDC, there are about 2 million incidents of workplace violence resulting in injuries each year. And also only about 20 to 60%, an average of about 45% of incidents are reported. So that really leads to the idea that there are actually 4 million or more incidents possibly resulting in injury. And then imagining the number of incidents that don't result in injury. So we'll talk a little bit about that under reporting concern. You'll see some data on there related to Cal OSHA. So what we did is we took a 5-year survey of Cal OSHA's interactions with their regulation for healthcare. And we thought this might give us some information and insight on how the healthcare systems were implementing the regulation and how Cal OSHA was interacting with them. So in that 5 years, there were 128 Cal OSHA inspections conducted. There were 134 citations issued as a result of those inspections, and citation penalties, once corrected, adjusted, resulted about $130 up to $18,000 per citation. So of those top cited violations, you can see not having it written down, not having that written plan, a lack of procedure to correct those hazards that were identified. So when inspectors were going in based on an incident, based on maybe a serious injury or online report, which it has to be done through healthcare, they were finding that the hazard happened, the incident happened, but there were no corrections in place, either before, no controls in place before, or corrections implemented after the incident. So that really good feedback cycle of investigating and responding to those incidents becomes important. And then the last top 3 citation was based on inadequate training. So either not doing it, not meeting the timelines for refreshers, not having someone trained before they faced the hazard. So we'll talk a little bit more about our solutions, but our top ideas on this was making sure that plan or program is written, keep it standalone from your IIPP. I know Cal OSHA always offers to have those programs as part of one big IIPP package, but we'll explain why we think they need to be separated. Conducting those annual evaluations. Is the program effective? What incidents happen? Is our training effective? And then cooking in the improvements to the recipe of both your program and training each year. Learning from each investigation, what are the root causes? Was it a lack of controls? Was it a lack of training? Was it not awareness of what's going on? What's in front of that employee? So next to you, David.
Thank you. So as Kerri had mentioned, here's some tips, tricks, pitfalls that we have experienced and we've had conversations with. So the challenge is the plan and program development. Where do we start? Where do you start? You start with the training, with the plan, the entire program. It can be very overwhelming to understand where you go and where do you start. And another question is, doesn't the IIPP cover this? Doesn't the Injury Illness Prevention Program cover this? And then EHS will develop. Do you need more help? Really, like environmental health and safety or health safety environment, however you say it, that group, do they cover everything? Are they able to work on their own? So some solutions here is to identify key roles and responsibilities. Who has the overall ownership of the plan, of the program? Who will understand and make sure that the plan is reviewed at least annually, make sure that there are appropriate updates being made? Making sure that you engage your stakeholders, looking at legal, human resources, environmental health and safety, security, IT. These are just some of the areas and departments that you should be working with. So no, it's not just EHS working with this program. No, your IIPP does not cover this on its own because, as Kerri had mentioned, there are many other areas that are required by this California Senate bill that is not necessarily covered in your IIPP. Making sure there is employee engagement. Gathering feedback of all elements, written program, the hazard evaluation. These are all employees having a word and understanding what their environment is around them. Hazard controls, incident investigations, and trainings, employee engagement through all of it. So, and some solutions here for the employee engagement is listening to your listening sessions, line employees, authorized representatives, publish share modes for draft reviews, making sure that you hear and that you have others involved. It's really important to make sure that it's not only those departments that are working together to develop the plan, but your line employees have a word and understand what they need, have a word in what hazards they are vulnerable to or feel they're vulnerable to. And of course, the training sessions as well. Kerri?
Yeah, and I think that's a good point, David, with that employee engagement is sometimes clients may not have interacted in this manner. They're used to creating a program, rolling it out and seeing it taken up, and they may not be familiar with some of the newer Cal OSHA regulations that are requiring that employee engagement. So it can be an alien feeling, inviting additional members to the committee table to come up with that. But we're hoping that with some of those solutions, those are some ways to encourage that conversation. So then when we're talking about that facility-specific hazard evaluation, so this piece beyond just in general, our industry has these hazards. In general, our facility has these hazards. The labor code in California is being very specific that when it comes to a person's job or their facility, that they get additional training, that they have additional evaluation of what their specific hazards are. And that can be really daunting depending on the size of the organization, how people are spread out, the different roles that they are taking. So we have a couple of options on that. First of all, starting with some risk evaluations. So this is a tool that can be used to identify who and where what are the types of hazards that they face, categorizing, is it environmental? Maybe they are in a field setting, maybe they are working alone. Are there behavioral? Do they work with employees, customers, clients that might be in crisis? Are they in interactions that may have high conflict, customer service issues, things like that? So identifying those, we have some tools available that we've been using to help facilitate that conversation, delegate the hazard evaluation and data gathering. So using a security checklist, having an appropriate way to systematically evaluate each job, each work environment. And then you can take those pieces from the security checklist and pop them into your training. You know, we reviewed this job, we reviewed this facility. These were the identified hazards. For example, we work with cash. For example, we have a public service counter. The next tool we use is sort of a playbook of these are some of the controls and corrective actions that can be implemented when a hazard is identified. So, for example, we have a public counter. Well, here's our playbook options for providing public service and maybe charging people fines or penalties or just goods and services. Here's some options. Maybe we have barriers. Maybe we have a deep counter that prevents someone from reaching over. Perhaps we have access control at that counter space that only staff can be behind it. So using that playbook, using the security checklist, you can identify hazard and control. Take that information and put it onto your job or facility specific training, which we'll talk about a little bit more. So for that training, how do you disseminate that granular level of information? And some of the solutions we've been coming up with is having a training on the company level, but then also having additional training for that job, facility, unit that gives them the nuts and bolts of what they need to know. So go ahead to next slide. So here's an example tool that we've been using. Company overview training. Here's our program. Here's who's in charge. Here are their responsibilities. Here's how you can participate. Here's how you report. Here's our basic response and some ways that you can stay safe. Then you take that information from the security checklist, from your playbook of options of controls and corrections that you already have in place or that you may implement. You can put them on a tailgate topic, one sheet handout for your job or facility specific, and use that to train and support that overview training. So that may be a shorter, pointed, very particular. The panic buttons at our location are at the front desk and the conference room. They call security. The way you will be notified of an emergency is over PA or verbally. All of the information that individuals need to know for their job or their facility specific can be documented on an example handout like that.
Thank you, Kerri. So one of the challenges that has been observed from past experiences with especially within the healthcare and then in general industry is underreported incidents. Knowing very well that workplace violence incidents are not reported, and there are many reasons why they may not be reported. Some may not be aware that it is an incident that they're involved in. Is this really an incident? It didn't really sound like a threat, but it could have been. You want to make sure that there is always the report. Plain threshold for threats and violence. The person didn't really mean to do it. They'll come up with, your colleagues, employees will come up with excuses. Oh, they're just having a bad day. Well, you know what? That bad day can turn into a horrible day very quickly. So you want to make sure that every incident is reported. every potential, every near miss, making sure that they are reported. And how do you do that? How do you promote this reporting and the safe reporting? Making sure that you emphasize that you have a program, you have a plan. Emphasize the reporting structure within your organization. If I'm an employee, who do I report to? I report to my manager or my supervisor. What if my manager or my supervisor is the one that's making the threats or is having threats? Then I need to report to whomever that would be, human resources or security, right? Making sure that there's a clear delineation and making sure that there's a clear path for making that report. Follow up on all reports. Who follows up on those reports? This is the roles and the responsibilities, making sure that the roles and responsibilities are clear, that there is delegation of authority, making sure that everybody understands their role. Promoting the right to a safe workplace, making sure that everybody understands that there is some safeguard against who's making that report. So yes, the reports are made available, or they are upon request to any employee and authorized employee representative. At the same time, it doesn't necessarily need to share who made that complaint or who made that report. Just need to know the type of incident that is being reported and when. So point out that it is illegal to retaliate against employees for reporting. Kerri?
All right, so another challenge may be, how many incidents are we going to get? How many have we had? How do you gather that data and make it meaningful? So if you don't design with that end in mind, what data are we going to want to use in the future? Having it in the report form, having it in the log, having it in your investigation process, you may not be gathering the information that you need to understand throughout the organization, throughout the locations, throughout those different job descriptions, where the incidents and hazards are happening. So thinking about how can you design your forms, your investigation reports, your log, so that you gather the data now that you're going to need later. Sometimes this can be very eye-opening. If you suddenly get to the end of the year and you want to consolidate all your information and you don't have a key piece of information, it can be very time consuming to find that later. You may see that violence is happening in the locations that you least suspected it. It may involve, we had clients that expected to have weapons information, guns and knives were what they expected. What they saw were canes and milk cartons. So that's a very different outcome than the hypothesis that they started with at the beginning. So having that information ahead of time in your forms, gathering at the time of the incident, can help you see what's happening, who's doing it, where are they doing it, and much like the game Clue, in what room with what weapon, the candlestick. You can then have that information later on, analyze it, present that to your staff for training, bake in any lessons learned to your training and program, and that drives that continual improvement that you would want to see.
So the next challenge is communicating with other employers. Understanding that your program, your plan is required to coordinate with other vendors and others that are working on your site. Do you have contractors? You need to make sure that you are communicating with them. How do you communicate with them? What do you communicate with them? Well, who are those players? Identify those vendors, those contractors, temporary employees, the staff, volunteers. Making sure that you're communicating with everybody that is on your work site or potentially to be on your site. Use a job or facility specific tool, your one pager, using those trainings that you've developed, making sure that you include the onboarding process for those contractors. What are their rights? Who do they report to? If there is an incident that they are part of, if they are witnessing an incident, who do they report to? Do they report to internally within your organization or within their own organization or both? Making sure that that reporting process is clear. They also have a right to access to your program, understanding what your plan says. They're working on your site. They need to know what your plan is, and they are adhering to your plan and your program. So making sure that the training program is implemented and applied by July 1st deadline. So if they are expected to be on your site on July 1st or after, they need to have this training as well. So some best practices: build and scalable program for training. Build your program with the end in mind. What is your goal? You have this plan. You need to develop this plan. You need to develop the training, develop that program organization-wide, making sure that your employees recognize those hazards. They are providing those hazards. That hazard assessment needs to be completed by July 1st. That initial assessment. If you haven't done one already, it needs to be completed. And then the job and facility specific requirements, procedural details, training supplements, organizational training. That training is not only one way. As Kerri had mentioned earlier on as well, that training is very detailed. That training process includes the right for the employees to ask questions. They need to understand who do they go to if they don't understand something, if they need clarification on something. As part of that plan. Best practices: keep your program separate from your IIPP. So why do you keep it separate from your IIPP? And Kerri had referred to this earlier on. Organize your safety programs in separate documents. This allows you for the inspections to be applicable procedures to the procedures and the trainings specific to workplace violence. If there's an incident, if there's Cal OSHA is coming into your site, once you open up your plan, you are leaving yourself open and all of your plans open to everything and interpretation, making sure that this prevents opening, as it's stated here is your keys to your file cabinet, right? So basically you're opening everything, all of your documents. If only one area is being inspected and assessed, that's the one area that needs to be available to the inspectors. If they're looking for something else, then they need to make sure that that is specific. Many workplace violence prevention procedures reference existing IIPP procedures and forms. So reporting hazards, incident investigations, incident response, these are all part of your plan that's part of your IIPP, making sure that it is clearly delineated and clearly separated. Kerri?
That's a really good point, David. I think what we're hearing from clients is, how do I investigate a workplace violence incident? And reinforcing, use your existing processes. Don't try to reinvent the wheel. Maybe add some additional questions specific to workplace violence, but really get the benefit and the efficiency of that work that you've already done. So related to training employees, when we're talking about training them on general program, how the company is implementing it, what hazards were identified, how to stay safe, one of the things that we've found over the years through training is employees report, I don't need to worry about this. We have a security guard on site. I don't need to worry about this. We have closing and locked gates. Relying on guns, guards, and gates to protect employees is not enough. So really reinforcing with employees that in addition to all of the controls that the employer may have in place, they have to do their own individual risk assessments. And there's different methods used, the STAMP method, BROSET scores in healthcare, for example. We often use the Washington State 5 warning signs of escalating behavior. But whatever system you're using, train employees to that so that they can conduct a real-time, person is right in front of you assessment, watch for escalating behavior, Be prepared with appropriate responses to try to de-escalate, provide customer service, but also take safe actions to get out of there or get help if it gets to that point of hostility. So training employees not to continue to conduct business as usual when they start to see those escalating behaviors. Talking ahead of time, what are some alternatives? People may get very mission focused. They may have grave concerns about providing emergency response and support to a customer or just good customer service. But coming up with options to reschedule, come back with a backup or an escort, take the meeting, maybe not in a private office, but in a public area or just-in-time conference room. Whatever those may be that are appropriate to your operation, but thinking about them now so that employees have options when they are faced with that escalating behavior. Next. We often get a lot of requests during workplace violence prevention training for active threat, active shooting procedures training. So this is not required at this time, but recommending it as a best practice to offer to employees, whether it's through some of the more common videos that are available on YouTube, but also partnering with local law enforcement who usually have active threat trained officers that are willing to come out and meet with your staff in person and have these conversations beyond the run, hide, fight procedures. Looking at your organization, incidents are increasing. Is your organization one of these facilities or business types that tends to have more incidents? You may want to place more emphasis on this. The importance of that training helps employees to understand that this can happen in their workplace. It can happen in their private time. Giving them that survival mindset, that believability mindset, so that they can be able to think ahead and act accordingly if they do get involved in one of these incidents. Having it specific to your facility or occupation, job hazard, and job procedures can help employees understand, where are my exit routes? Where are the areas that I can go if I can't run? Where can I go hide? Which offices have locking doors? Can I get to a storage room and lock it behind me? And then if they do need to fight, what resources are available to me in my office? The next best practice, when we look at that 1/3 of workplace violence fatalities are suicides, that is a number I always emphasize in training because I think that is a number that we can really move the needle on, focusing on that well-being, that total worker health, by recognizing that it is a big part of those fatalities. Looking, is your industry one of those top 5 industries, mining, quarrying, oil and gas, construction, services like automotive repair, ag, forestry, or transportation and warehousing, those main industries, the main occupations of doctors, dentists, police, finance, real estate, lawyers, are all of those folks in your organization and at higher risk? And if so, taking proactive steps, really emphasizing employee well-being, having those employee assistance resources, making them accessible and promoting them so that employees, there's no stigma about offering or receiving those services. And then really promoting that social connectedness so that employees, where we spend so much time at work every day, we have, beyond that professional satisfaction, we also have that social connectedness that we all need. And then another best practice, which with this group is exactly what you are all doing, is that continual improvement. It's written into the labor code, but you already have it baked into your organizational efforts of looking at the ongoing program needs, the training evaluations, figuring out based on each incident, based on employee feedback, when you're interviewing them, when you're conducting a training evaluation, what pieces of that can be baked back into the plan, back into the training to improve it each year, or if you want to do it more frequently, after each training or incident. We also, in that facility specific tool that we use, we have a piece of that so that when a supervisor or facilitator is training at that job or facility specific level, any feedback from employees can then be funneled straight back up to the program administrator, collated and used to improve that later on. All right, so with this community, with consultants, with your peers, we've got your back. Having this conversation, just being here today, talking with your peers at conventions and seminars about this workplace violence labor code change, but also the trends and the efforts that are being done outside of California can really help get what are the best practices, what are the other tips and tricks. You may even have tips and tricks to share with this group today, so we would definitely welcome that. But we collated these together from our experience. We've been doing this work long before this law, long before healthcare, because this has been a growing trend nationally to recognize and helping employers write these programs, doing those risk and security assessments from high-level job hazard assessment to actual facility security reviews, and then that training, making sure that we can customize it, deliver it in ways that make sense for the organization, whether it's online, instructor-led, desk tools, handouts, whatever is needed. We have one case study example here, just where we helped a large healthcare organization implement the workplace violence regulation and training for their group. And with 5,000 employees, multiple locations, they were really concerned about how to conduct that training in an efficient manner and meeting deadlines that were required in the 2017 regulation. And obviously, a lot of people are watching that July 1st date come very quickly and asking us, is now the time to panic? And making sure we've done this before. We have solutions for online training. With this particular client, we not only did the online training, making it available 24/7, but also instructor-led training. That instructor-led training was so rich and meaningful because it launched their program, it launched the conversation with their staff, and a lot of information came up from employees meeting face-to-face with facilitators who then gathered that information and shared it with the client so that they could take action from all of the feedback that came from that. So here are some other resources we've been working on over the last few years as we were anticipating the regulation. We've written some blogs on total organizational efforts towards workplace violence prevention. I really do believe that this is a safety issue, a well-being issue that together we can reduce these incidents, we can create a safe work environment. And then really diving into what are the elements of compliance for these new SB 553 requirements. And then if you're interested in more statistics on our Cal OSHA study of the 5 years of healthcare regulation, we have that in our Insight paper showing all the details from that research. And all of that available on the BSI website. So thank you very much for joining us. I know Sierra may have time to facilitate a Q&A session and also welcome any tips, tricks, pitfalls that you've encountered in implementing this as well. Thank you.
Absolutely. If you have any questions that you'd like us to address, please leave those in the chat. Or like Kerri said, any tips, tricks, pitfalls, best practices that you've implemented in your site, we'd love to hear those as well. A couple questions that have come through. Do you have any information or statistics or definition for how OSHA, Cal-OSHA, and the FBI lists and defines what a workplace violent event is? You mentioned some of that underreporting is contributed to or is attributed by the fact that people don't know that an incident was an incident to report it. So do you have any definitions for what that constitutes?
Yes, there are. The first is to go to that OSHA site, understanding that OSHA has those 4 different definitions of what workplace violence is and what may constitute as workplace violence. But additionally, it's going to be a physical attack with or without a weapon, or any type of object, threat of physical force, sexual assault. The FBI also has definitions that work just as the Cal-OSHA Senate bill states about stalking and harassing, verbal abuse, physical aggression. So those are the types of physical and as well as threats that constitute. And that's not the end all be all list, but that is a lot that would cover under the Senate bill.
Thank you very much. And then I had another question regarding the written procedures, especially pertaining to active shooter. Do you think it's repetitive to write out all of those procedures, including your active shooter, since you recommended not referring to the IIPP or the EAP for the program?
I would refer to your IIPP and EAP and ERP. Let's talk about all the alphabets. So your injury and illness prevention program, referring to those basic procedures is fine. What we're recommending is that you do not include it in your IIPP. And same thing for your emergency action plan or emergency response plan. Many of the responses that you may want to reinforce in a workplace violence incident would be in your emergency action plan or emergency response plan. So definitely refer to them, pull out that detail that you may want to emphasize in your program, emphasize in your training, but you don't have to cut and paste your entire ERP into your workplace violence incident program.
Thank you very much. Then another question regarding OSHA 300 logs. Will this make it to the OSHA 300 log for reporting purposes or only if an incident occurs?
Really good question. And I think we'll have to see a little bit more how that gets defined. I would look at, did you have to provide first aid? And that is something that you can build into your report form and your investigation form. So that's going to inform, does this need to go on our log? And certainly, was there an injury and what type of injury it was? And then that can inform the log. The other incidents, and maybe some of those near misses too, if you've got, wow, it was almost an incident, but I de-escalated it. That near miss log will also help you understand, hey, how effective are we being face-to-face, at the counter, over the phone, to diffuse that type of incident?
Absolutely. Record keeping roulette's always a tricky game. It's better to kind of wait and see how things play out a little bit, but always refer back to the kind of bread and butter basics of it. Another question, just for curiosity's sake. Cal-OSHA is obviously looking specifically at general industry for this, but do you have any specific pieces of advice or plans moving forward for the mobile workforce folks should keep in mind?
We have clients that are mobile workforce, and it's tricky. There is an exemption in the labor code for employees that are teleworking at a location not under the control of the employer. However, when you do have any type of bricks and mortar meeting, you'll need to plan and prepare them for that type of thing. But also just as general duty or IIPP requirements, if you've got a mobile field force, that is one of the hazards, right? They're working alone. They may be doing processes or procedures that are not super popular with the clientele if they're inspecting or gathering receipts, things like that. So just as a general duty and IIPP, you would want to have hazard evaluation and controls and training. David, any thoughts on mobile employees?
No, you covered it. That's it.
Thank you very much for that. And then if we have any other questions, otherwise we'll wrap up on just this last one. You mentioned it's important to always involve your contractors and vendors and the outside providers in your emergency plan and your training. Do you advise sharing pertinent parts of your emergency action plan with nearby companies in kind of the same way that adjacent refinery fire teams would train together?
So this is specific to the emergency action plan or for the workplace violence plan?
I think this is the workplace violence plan. Sorry.
Okay. So in general, you do not need to share this plan with nearby companies or agencies that are near you, or only those that are working on your site or your facilities. If you are a vendor or a contractor and you happen to be working at another site, you have a right to understand what their plan is. So if you're going to another company's site and you are working over there, you can have a right to understand what their plan is. And if you're experiencing violence or a threat of violence, then you need to report it as well and understand what your internal plan states, and understanding where to report internally to that organization as well. And making sure that, you might be a contractor or a vendor or an employer within California, but just because this is a California Senate bill doesn't mean that it cannot be applied across the country or across the world. So if you're a global company, this plan here actually is more, as Kerri had mentioned earlier, is actually more strict than other states across the nation. So applying this across the nation, be careful with some of the verbiage that you use, but it can absolutely be used. And we've worked with clients and customers throughout the nation and throughout the world that apply this Senate bill to workplace violence prevention program for the entire company, not only those locations in California.
Excellent. Thank you very much. We don't have any other questions. Going once, going twice. And so if anything does come to mind between now and later, please do feel free to reach out to us and we can get you in contact with folks to get your questions answered. But in the meantime, I want to thank you, Kerri and David, for volunteering your time to be with us today. And of course, a huge thank you to BSI for sponsoring today's presentation and making it possible. Again, if you are interested in learning more about their offerings and resources and consultation, links can be found below, and I do highly recommend it, especially if you are in California and you are staring down that deadline. You will also find links to some upcoming events that might be of interest to you. We are celebrating the 3rd anniversary of our Labor Summit on June 6th, covering that great struggle between prioritizing safety versus productivity. And then on June 13th, we will be joined by Chris McGlenn with Roco Rescue to talk about confined space fatalities. And then, of course, the Safety Plus Symposium is just around the corner this August 25th through 28th in beautiful Denver, Colorado. And I hope that I will see some of you there. As always, if there are any particular topics or questions that you'd like to see us address in the future, do please let us know. And with that, thank you all, and I hope you have a wonderful rest of your day.
Thank you. Thanks, Sierra.